recognize it. So here's my analysis. Racism is causing more COVID-19 deaths in Black folks compared to other folks because we are more exposed, we are less protected, we are more vulnerable health-wise because we have carry more of a burden of excess disease because of the conditions of the communities in which many of us have been segregated. And the last piece is the only piece about healthcare. We have less access to healthcare and the healthcare that is going to even respect our lives. So let me go a little deeper on the more exposed, less protected, more vulnerable because of the chronic conditions that we carry more in our bodies, the burden of living in a racist society, and less access to healthcare. So you see, it's not a big healthcare thing. More exposed because of the kinds of jobs that we have, being on the front line, being, maybe not even being, we're certainly not overrepresented among the physicians, but we are overrepresented among the folks cleaning up the hospitals or the CNAs and the like, turning the patients, the food service in the hospitals, where even those kinds of jobs right in the hospital for the first few weeks, months maybe, weren't recognized as being part of the essential workforce. But we also more represented in jobs where you can't work from home. So if you're a postal worker or a sanitation worker or you're a grocery clerk or you're doing the deliveries to get people's groceries to them so that they can safely shelter in place, all of this, we are overrepresented in that kind of workforce. And also we're overrepresented in jobs where we don't have paid sick leave, even if we feel sick or we need to stay home to be the teachers for our kids when the schools are closed, right? So without the paid sick leave, without the wealth to kind of fall back on, so all of that. So we're more exposed in those kinds of jobs. We're also more exposed because we're severely overrepresented among people who are jailed and people who are incarcerated in our prisons. And then brown folks overrepresented in the people, in the immigration detention centers and the like. And we're also more exposed because we're more likely to be unhoused. So we're more exposed in terms of the workforce, but also in other places where we are overrepresented. Now, even in those jobs where we're more exposed, we're less protected. For example, Jason Hargrove, the bus driver who was in Detroit talking about this woman coughing all over without covering her mouth. And then 2 weeks later, he's dead, not given the PPE that other people who are now recognized to be in the essential workforce have been given. So, and we not even given hazard pay. So that's another thing in terms of being appreciated. So more exposed, less protected, therefore more infected. But then once we're more infected, why should our death rate still be another magnitude higher? So if you're twice as infected as our representation in the population, why are we 3 times as likely to die? And that has to do with the chronic diseases, which is not because we don't know what to eat. It's not because we're lazy or stupid, right? It's not because we are more vulnerable, there's something genetically different about us, because there is not. It's because the communities in which many of us have been segregated, have been disinvested, have been poisoned by environmental racism. If you have a racial segregation in housing, it turns into racial segregation in terms of educational opportunities, racial segregation in terms of exposure to fresh fruits and vegetables or green space where you can go out and play. And then we're in neighborhoods that have actually, there's a term for it, sacrifice zones, where we are living next to polluting industries and the like. So anyway, so it's because of living in those kinds of communities that we have more of the diabetes, more of the heart disease, more of the hypertension, the asthma, more of the kidney failure, that once you have the infection, it's making you have a more severe form of it, and then ending up in death. Then these very same neighborhoods, often the health facilities, so sometimes these are the neighborhoods which are the teaching hospitals, where the teaching hospitals are, where they teach the interns and residents and the like. But sometimes we're in neighborhoods where the hospitals have closed down because maybe there weren't as much of the elective surgeries or whatever to keep them open, or maybe they don't have all of the high-end ventilators or all of the stuff there. Also, many times we have been calling saying, I'm sick, I need to come in and get a test, and even ending up at a testing center or at an emergency department and then told, well, go home and rest. And there was last Sunday, there was an article in the Detroit Free Press entitled, "They Sent My Mother Home to Die," right? And that is happening to us.